The psychodermatological role of cosmetic dermatologists and beauticians in addressing charismaphobia and related mental disorders. Cosmetic dermatology, being an emerging subfield of medical science, involves surgical and non-surgical procedures to deal with the problems of physical appearance such as skin diseases, anti-aging processes, rejuvenation procedures, liposuction, laser hair removal, hyaluronic acid injections, laser skin resurfacing, genital cosmetic surgery, body contouring, vascularized composite allotransplantation, labiaplasty, etc. The field of cosmetic dermatology is flourishing day by day. Several new fields have been formed in this regard. Dermacosmetics involves products that are made of biomaterial nanoparticles through nanotechnology such as niacinamide, salicylic acid, nicotinamide, etc. Cosmeceuticals is a propagating field which integrates cosmetics and pharmaceuticals by involving products that are used to rejuvenate the skin, making it healthy and protected from diseases. Psychoneurocutaneous medicine and psychodermatology are amalgamation of neurology, mind, and skin. Psychodermatology is concerned with several mental abnormalities associated with physical appearance and attraction. Physical unattractiveness and the perception of a negative body image have been recognized as an important public health concern worldwide. Cultures associate pleasing appearances with positive human. Unattractive appearances, on the other hand, are associated with negative personality traits. Such stereotypical perceptions of societies play their negative role in lowering self-esteem and developing health-related hazards including depression and eating disorders. A positive body image results in positive behavioral outcomes and a negative body image results in destructive habits. Considering oneself physically unattractive or perceiving one's body negatively have been associated with several adverse effects such as frequent dieting, bulimic symptoms and dietary restraint, weight gain, poorer psychological well-being, depression, and lower self-esteem. Greater satisfaction with one's body and physical appearance, on the other hand, has positive associations with healthy behaviors, higher self-esteem, sexual satisfaction, and overall psychological well-being. The prevalence of psychiatric disorders in the patients of cosmetic dermatology is twice as high as in general dermatology patients. Psychodermatology sensitizes cosmetic dermatologists to be aware of the beauty-related psychological symptoms to analyze the mental health of their patients. Psychodermatology is a very latest field and lacks research. The study by Dr. Sukoon that is being presented here is a valuable contribution in this regard. This study had two aspects to address: A. Analyzing the prevalent role of cosmetic dermatologists and beauticians in the psychological issues of their clients, and B. Educating cosmetic dermatologists and beauticians on the relevant mental conditions associated with cosmetic dermatology, beauty, and physical attraction. The first aspect was investigated through structured interviews which had three objectives: A. To analyze the understanding of cosmetic dermatologists and beauticians on the psychological issues of their clients, B. To analyze the possible tendencies for different mental disorders in their clients, and C. To analyze how cosmetic dermatologists and beauticians handled the psychological issues of their clients. The second aspect, based on the findings of the first aspect, involved a comprehensive literature review to provide the necessary scientific knowledge to cosmetic dermatologists and beauticians so that they could address the psychological issues of their clients in a more informed way. Finding the voluntary participants of the study was a difficult task as professionals of both the fields were too busy to spare unpaid time. The study, however, managed to interview 73 beauticians and 30 cosmetic dermatologists from the cities of Islamabad and Rawalpindi of Pakistan during a timeframe of 3 months. The cosmetic dermatologists were medical doctors who were specialized in dermatology and were practicing in public or private sector. They included both men and women. Their age ranged between 30 to 60 years with a mean age of 43 years. Their professional experience as practicing cosmetic dermatologist ranged between 2 years to 35 years with a mean of 17 years professional experience. The beauticians were the owners of private beauty parlors. 72 of them were females and only one was a male. Their age ranged between 16 to 53 years with a mean of 33 years. The educational qualification of the beauticians ranged between 8 years of formal education to 18 years of formal education with a mean of 14 years of formal education. Their professional experience as beautician ranged between 1 year to 29 years with a mean of 9 years professional experience. A structured interview guide was used, along with a brief demographic sheet, to gather data from cosmetic dermatologists and beauticians. This guide included open-ended questions which were based on the objectives of the study. The interviewees were asked to convey their observations and experiences with regards to the psychological issues, symptoms of their clients. The interviewees communicated several psychological issues or relevant symptoms of their clients in plain language, such as low levels of self-confidence, distress, social comparison, inferiority complex, low levels of body esteem, anxiety, depression, social stigmatization, sense of being ostracized, deliberate self-harm, inspiration from celebrities, faulty eating habits, sleep problems, self-centeredness, self-loathing, sense of failure, desire to look younger, narcissism, asking for unnecessary cosmetic procedures, desire for social appraisal and social dominance, fear of being ugly, etc. This reflected the awareness of the relevant psychological problems of the clients by the cosmetic dermatologists and the beauticians. During the interviews, both the cosmetic dermatologists and the beauticians explicitly accepted the prevalence of several psychological issues among their clients. The cosmetic dermatologists and especially the beauticians, however, were not trained enough to label those psychological problems of their clients in a clinically appropriate way. Dr. Sukoon analyzed the possible tendencies of the clients based on their psychological conditions mentioned by the cosmetics dermatologists and beauticians. He derived themes out of these issues, symptoms based on the frequencies of the responses received from the interviewees. Tendencies for possible mental disorders among the clients of cosmetic dermatologists and beauticians were analyzed thereafter under the headings of DSM-5. The purpose of this exercise was not to label the clients with certain mental disorders. This analysis was carried out to understand the possible tendencies for certain relevant mental disorders. Social anxiety disorder was the top-ranked possible tendency, 34.38%, among the clients of both cosmetics dermatologists and beauticians. It was followed by body dysmorphic disorder, 20.55%, Charismaphobia, 16.57%, generalized anxiety disorder, 8.81%, major depressive disorder, 8.39%, histrionic personality disorder, 7.13%, Gariskophobia, 2.73%, and narcissistic personality disorder, 1.44%. These percentages, for example 1.44%, does not mean that 1.44% of the clients of cosmetic dermatologists and beauticians did possess the tendencies toward narcissistic personality disorder. It rather means that the overall tendency of the aforesaid clients toward narcissistic personality disorder was 1.44% among all the disorders mentioned here. Thus, social anxiety disorder got a tendency weighting 34.38% out of the 100% for all the listed disorders. The tendencies for all the disorders mentioned here make 100 if combined. The psychological issues, symptoms conveyed by the interviewees were categorized and labeled in a clinical way, instead of the plain language. The possible tendencies toward different mental disorders slightly varied between the clients of cosmetic dermatologists and beauticians. Social anxiety disorder, body dysmorphic disorder, and charismaphobia were the top 3 possibilities among all the clients of cosmetic dermatologists and beauticians. The cosmetic dermatologists and the beauticians were asked about the raise in their clientele based on the psychological issues of their clients. 90% of the cosmetic dermatologists and 89% of the beauticians agreed that the psychological problems of their clients did cause a raise in their clientele and business. The cosmetic dermatologists and the beauticians were asked if they were involved in providing psychological guidance and counseling to their clients for the aforesaid psychological problems. 70% of the cosmetic dermatologists and 66% of the beauticians agreed that they were involved in providing psychological guidance and counseling to their clients for the psychological problems causing dermatological or beauty-related concerns. None of them, however, was properly trained in psychological guidance and counseling. They regarded it as a moral obligation to counsel their clients for any psychological problems which were linked with the issues for which the clients consulted them. In other words, both the cosmetic dermatologists and the beauticians were providing psychological guidance and counseling to their clients with good intentions and did not intend to make any extra money out of it. In response to the question of referring the needy clients to a psychologist or a psychiatrist, 60% of the cosmetic dermatologists and 14% of the beauticians agreed that they did refer the needy clients to psychologists or psychiatrists. The interviewees were also probed if they took any possible opportunistic benefits out of the psychological problems of their clients. The cosmetic dermatologists, in this regard, recommended their clients to perform extreme medical procedures, the procedures which were not demanded by the clients if they were not having psychological issues, to satisfy them better. The cosmetic dermatologists also agreed that the psychological problems of their clients did contribute in making the clients dependent on dermatological treatments and increase the number of visits to the dermatologists. The beauticians, on the other hand, were found taking maximum advantage of the psychological problems of their clients. They were involved in selling nutritional diet plans, recommending herbal medicine, selling herbal creams, recommending multivitamins, and selling short courses for self-grooming. The beauticians also agreed that the psychological problems of their clients did contribute to raise the number of visits paid to them. The study by Dr. Sukoon revealed that the clients of cosmetic dermatologists and beauticians did possess such noticeable mental conditions which could be considered as possible tendencies toward social anxiety disorder, body dysmorphic disorder, charismaphobia, generalized anxiety disorder, major depressive disorder, histrionic personality disorder, gerascophobia, and narcissistic personality disorder. The earlier literature sufficiently supports the positive correlations between dermatology and psychopathology on several grounds. The study by Dr. Sukoon realized that the presence of psychological problems among the clients contributed positively to the clientele and business of the cosmetic dermatologists and beauticians. The findings of his study revealed that the understudied cosmetic dermatologists and beauticians were aware of the adverse psychological conditions and consequences of having dermatological or beauty-related concerns. They realized the prevalence of several psychological issues among their clients. The cosmetic dermatologists and especially the beauticians, however, were not trained enough to label those psychological problems of their clients in a clinically appropriate way. Moreover, the cosmetic dermatologists and the beauticians were involved in providing psychological counseling to their clients. Dr. Sukoon, in his aforesaid study, also intended to educate cosmetic dermatologists and beauticians on the important psychodermatological themes. He emphasized that cosmetic dermatologists and beauticians must realize that the concept of beauty is as old as humans and has been prevalent in almost all the cultures worldwide. Beauty is referred to the pleasing properties of an object. These pleasing properties are characterized by the balance, proportion, symmetry, complexity, contrast, and clarity of the object. The evolutionary perspective in psychology associates the Darwinian, survival of the fittest, principle with the physical attraction of humans, which is the strongest mean for social recognition. Social psychology, after recognizing the importance of beauty in social recognition, regards beauty as a broader psychosocial construct which involves several positive attributes of a person such as high intelligence, social competence, friendliness, likability, and leadership skills. Beauty also involves the inner qualities of a person such as character, values, ideologies, etc. The beauty of a human, to summarize, must be evaluated through the combination of one's outer features and inner qualities. The standards of beauty are set by culture and change from time to time, such as the trend of fat and chubby women from 15th to 18th century, the trend of very close-fitted dress and narrow waist in the 19th century, the trend of fleshy women at the end of the 19th century, the trend of athletic bodies in the start of the 20th century, and the latest international trends of lighter skin color, narrow waist, flat stomach, lower waist to hip ratio, long legs, thin jawline, small chin and nose, prominent cheekbones and plump, fuller lips, large buttocks, large breast size, hemmed stockings, and high-heeled shoes for women, and physical strength, muscular bodies, and higher socioeconomic status for men. Each culture may also develop localized standards of beauty which people find collectively attractive. The cultural standards of beauty and attractiveness are highly influenced by the local and international electronic, print, and social media, which changes public perception about beauty and attraction by editing pictures and videos of women unrealistically and presenting them as sex bombs. Media also promotes celebrity idealization. These unrealistic standards of attraction presented by media lead to several psychological problems related to dissatisfaction with one's body and appearance. Media puts a direct or indirect effect on men and women equally, but women take it more seriously. Social media is more powerful in this regard. The perceptual changes caused by the media help the beauty, cosmetic, and fashion industries to market their products conveniently. Based on the culturally accepted standards of beauty and attraction, people from all the cultures prefer to see attractive faces. The physically attractive people are socially more accepted. The society affiliates several positive attributes with the physically attractive people and considers them more positive, more helpful, more intelligent, more friendly, less criminal, better students, more likely to be employed, and hired on higher wages. The role of physical attractiveness is considered extremely important in marrying, dating, and remaining satisfied with a marital or committed intimate relationship. The psychological problems related to beauty and attraction can specifically be related to women. Women face more cultural impositions and are, therefore, called the bearers of culture. Societies objectify women sexually, evaluate them for attraction more than men, put more pressure on them to stay beautiful, and promotes professional success for women who are more beautiful. Studies involving more than 37 cultures revealed that men want beauty in women and women want wealth from men. Since women also want social appraisal, they realize the social pressures on them and get convinced to be more valued by being sexier. The acceptance of these social pressures put women more at risk of several psychological problems. Most of the psychopathological literature, therefore, reports higher tendencies towards mental disorders in women as compared to men. Cosmetic dermatologists and beauticians must profess valid knowledge on those psychological conditions that may prevail among their clients and may hinder in the way of treatment or self-grooming. Body dysmorphic disorder (BDD) is the most relevant in this regard. Summarized as imagined ugliness, BDD has also been known as dermatologic hypochondriasis, beauty hypochondria, dermatophobia, dermatologic non-disease, atypical somatoform disorder, and distinct somatoform disorder. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the diagnosis of body dysmorphic disorder is made through the preoccupation of a person with perceived defects or flaws in physical appearance that are not observed by others. Patients with BDD view themselves ugly based on certain body parts which, according to their perception, are not exactly the way they want. Patients of BDD are in the habit of seeking unnecessary dermatologic and cosmetic treatment. The self-discrepancy theory suggests that patients with BDD are confused between their actual and ideal selves. BDD can be a result of childhood regression or trauma. Patients with BDD have been found more among the patients of cosmetic dermatologists as compared with the patients of general dermatologists. Patients with BDD roam around different general physicians, dermatologists, or ear, nose, throat surgeons for approximately 10 to 15 years until they are labeled with BDD. Women are more affected by BDD. Patients of BDD may also have symptoms of anxiety, depression, aggression, suicidal ideation, suicidal attempts, sexual dysfunction, post-traumatic stress disorder, social phobias, skin picking, substance abuse, obsessive-compulsive disorder, eating disorders, obesity, shame, and guilt. Studies indicated that approximately 76% of the patients of BDD consult surgical or non-surgical cosmetic treatments to get rid of the perceived physical defects. It is very important for the cosmetic dermatologist to know that the treatment provided by dermatologists, cosmetic dermatologists, plastic surgeons, psychiatrists, or any other medical specialist has not been effective with the patients of BDD, as the patients always remain unsatisfied in this regard. Psychotherapy, on the other hand, has been found as an effective way of treating the patients of BDD. BDD is strongly correlated with social anxiety disorder (SAD). BDD is also perceived as a subtype of SAD in some Eastern cultures such as Japan and China. SAD is simply the fear of negative evaluation. SAD, also called social phobia, is persistent anxiety, fear of being humiliated or embarrassment while being observed or scrutinized by others in either generalized or specific social situations. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the diagnosis of social anxiety disorder is made through the anxiety of being scrutinized or being negatively evaluated by others. SAD has been found more prevalent among women than men. SAD adversely affects relationships, work, studies, daily life, and quality of life of the patients. Psychotherapy has been found effective in the treatment of SAD. Charismaphobia is simply the fear of aging. It falls under the category of specific phobia in the Diagnostic and Statistical Manual of Mental Disorders. The understanding of aging in a person's cognition is developed by social institutions, social norms, social interaction, judgments, gender socialization, media representations, and professional knowledge. One's understanding of the process of aging is directly linked with self-esteem, behavioral outcomes, well-being, and self-identity. Getting older is usually perceived negatively. Fear is an unpleasant emotion which is based on cognitive, behavioral, and physiological aspects. Charismaphobia, also known as aging anxiety, is an abnormal fear of growing old, and a prejudice by one age group against another age group. The symptoms of charismaphobia may include detachment from reality, anxiety attacks, breathlessness, excessive sweating, nausea, dry mouth, shaking, heart palpitations, inability to speak or think clearly, and fear of dying. Younger and elderly both may develop charismaphobia. The most common worries involved in charismaphobia could be worrying to lose personal independence, dignity, physical attractiveness, self-efficacy, and self-confidence. Fear of aging can be developed by several factors such as one's perceptions, knowledge, and beliefs, narcissistic personality trends, desires to live longer and death anxiety, desire to be associated with a group of younger people, cultural stereotypes related to aging and elderly, and generational conflicts. Fear of aging has been found more in women as compared with men. Charismaphobia is a new psychopathological condition discovered by Dr. Sukoon. It is the fear of unattractiveness. Charismaphobia is distinct from the similar mental conditions through its special focus on the aspects of cultural expectations and social pressure of being attractive. Body dysmorphic disorder, for example, focuses more on the perceived defects in physical appearance or body parts which are not observable by others. The charismaphobic unattractiveness, however, is observed by others too, such as having a dark skin color or not being fairly white is considered unattractive by both the person and the observer in certain parts of the world. Body dysmorphic-like disorder emphasizes on the actual physical flaws which are observable by others. The adjustment disorder does not focus specially on beauty and physical attractiveness. Charismaphobia is specifically related to aging. Charismaphobia, i.e. the fear of unattractiveness, is based on the cultural and social pressure of being attractive, instead of actual or perceived physical flaws in human body. Charismaphobia can be present in both the sexes. The clinical symptoms of charismaphobia include the excessive above normal and persistent above 6 months presence of having a strong desire to be socially appreciated for physical attractiveness and bodily features. Alone, B. Having a strong desire to dominate others through physical attractiveness alone, C. Having a strong desire to look significantly younger than the chronological age, D. Having a strong belief to be comparatively better than others, based on physical attractiveness and bodily features alone, E. Spending unjustified time on the internet to follow latest fashion trends, F. Being extremely sensitive and selective in dressing, G. Having anxious thoughts for being regarded as unattractive by others, and H. Taking medically unjustified measures to get or stay attractive. To label a person with charismaphobia, symptoms G and H must be present, which refer to the main theme of charismaphobia, i.e. anxiety. An earlier study on charismaphobia by Dr. Sukoon revealed significantly higher levels of charismaphobia among men as compared to women, significantly higher levels of charismaphobia among married as compared to unmarried, significantly higher levels of charismaphobia among housewives as compared to working men and women, significantly lower levels of charismaphobia among chubby people as compared to people with muscular, curved, or slim bodies, significantly higher levels of charismaphobia among people with dark brown skin tone as compared to people with fairly white, pale white, or brown skin tones, and significantly higher levels of charismaphobia among people whose subjective age was younger than their actual age as compared to people whose subjective age was the same as their actual age or older than the actual age. The study also found significantly positive correlations of charismaphobia with age, income, and education. Generalized anxiety disorder (GAD) is simply worrying about the future excessively. GAD is regarded as a chronic and impairing disorder. It is a basis for several other mental disorders and a risk to several chronic medical problems including depression and cardiovascular disease. The patients of GAD have been considered as the most common patients of any outdoor patient department in hospitals. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the diagnosis of generalized anxiety disorder is made through the excessive and uncontrollable worry, restlessness, fatigue, irritability, muscle tension, and disturbance in sleep. Patients with GAD worry to avoid and reduce the ongoing distress. They have cognitive hyperactivity and highly intense perception of emotions. Other significant causal factors include negative life events, parental neglect, maltreatment, loss, interpersonal problems, etc. GAD is highly prevalent. Women experience GAD more than men. Psychotherapy has been found effective in treating generalized anxiety disorder. Major depressive disorder (MDD) is simply profound sadness. MDD is the most frequent mental disorder affecting more than 300 million individuals. It is an important challenge to global health. It is predicted that depression would be the single leading cause of the disease burden till 2030. MDD impacts humans more than any other common physical disease such as diabetes, angina, asthma, or arthritis. It has a potential to develop several medical conditions such as diabetes and cardiovascular disease and adversely affect the general health of a person. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the diagnosis of major depressive disorder is made through depressed mood, loss of interest or pleasure, sadness, hopelessness, worthlessness, weight loss, insomnia, hypersomnia, psychomotor agitation, fatigue or loss of energy, problems in concentration, death anxiety, and suicidality. Suicide is strongly correlated with MDD, and it has been reported that 50% of the suicides are conducted in a depressive episode. MDD is also positively correlated with premature deaths. The lifetime prevalence of MDS has been reported as 2 to 21% worldwide. Several environmental factors such as loss of employment, financial constraints, exposure to violence, separation, bereavement, neglect, and abuse in childhood, etc. have been associated with its development. MDD adversely affects a person's cognitive functioning, work performance, and quality of life. MDD is also found to be more prevalent among women and occurs twice in women than men. Psychotherapy has been found effective in treating major depression disorder. Narcissistic personality disorder (NPD) is simply an arrogant and unempathetic personality who desires unjustified admiration. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the diagnosis of narcissistic personality disorder is made through a pervasive pattern of grandiosity, need for admiration, lack of empathy, fantasies of unlimited success, a belief to be a special person, and the desire to treat it in a special way. NPD is a serious mental concern which may result in functional impairment and psychosocial disability. This personality disorder is typified through shy, overt, covert, arrogant, grandiose, and oblivious characteristics. Patients with grandiosity features of NPD exhibit arrogant attitudes, seek attention, need admiration, lack empathy, have a sense of being special, and want to be perfect. Another distinct feature of NPD can be related to narcissistic vulnerability, in which patients feel more insecure, have lower self-esteem, have intense feelings of shame and guilt, and withdraw themselves from social interactions. The emotional mismanagement during childhood, rejection or overprotection, has been regarded as a primary cause of NPD. NPD has strong comorbidity with bipolar disorder, mood disorders, anxiety disorders, substance abuse, non-suicidal self-injury, suicidal attempts, and other personality disorders. NPD has also been associated with relational and marital problems. Males are more likely to have NPD than females. Females with NPD, however, have more concerns related to the physical appearance as compared to males. Psychotherapy can be an effective way to treat NPD. The empirical evidence, however, does not reflect significantly positive outcomes of psychotherapeutic or psychiatric treatment with the patients of NPD due to the higher rates of sudden or premature termination of the therapeutic process by the patients. Histrionic personality disorder (HPD), also called dramatic personality disorder, is simply a dramatic personality who is extremely emotional and attention seeker. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the diagnosis of histrionic personality disorder is made through excessive emotionality and attention-seeking behavior, being uncomfortable in situations in which the person is not the center of attention, inappropriate sexually seductive or provocative behavior, excessively impressionistic style of speech, self-dramatization, theatricality, and considering relationships to be more intimate as they actually are. HPD can cause distress and functional impairment. Patients with HPD are emotionally expressive, want to party, have large social circles, desire to be the center of attention, are overly seductive, exhibit improper sexual encroachments, and want to draw the attention of others by their personality, clothing, physical appearance, garments, etc. Some prime causes of HPD are parenting styles, trauma and other negative emotional experiences in childhood, and family history of personality disorders. HPD has a high comorbidity with all other personality disorders, depression, dissociative disorders, anxiety disorders, and suicidality. HPD was primarily regarded as a female disorder, but some recent debates, however, have found no significant differences between men and women with regards to HPD. Psychotherapy has been found effective in the treatment of HPD. Cosmetic dermatologists and beauticians should also have an adequate competence to provide some basic counseling to the clients whose dermatological or beauty-related problems also involve psychopathological bases. The purpose of this counseling should be to educate the clients on the psychopathological aspects involved in their problems and to sensitize the clients to seek professional psychological help in this regard. The first step to achieve this competence is to profess the relevant knowledge on the possible psychopathological conditions relevant to the clients of cosmetic dermatology. It is extremely important to realize that having the valid knowledge is a prime condition in counseling competence and the main asset of the counselor. The therapeutic relationship is the next important factor, which is considered as the main agent of change in counseling and therapy. This relationship should be based on warmth, respect, empathy, genuineness, and trust. An effective counselor establishes a positive relationship with the client, recognizes and resolves client's resistance, and understands the concepts of transference and countertransference. Communication skills of a counselor are also of extreme importance for the effectiveness of counseling. An effective counselor also understands the cultural aspects related to counseling. Cosmetic dermatologists and beauticians should understand the severity of the psychopathological issues of their clients. Based on this assessment, they should share the required knowledge with their clients and counsel their clients to get professional psychological support from a well-trained psychotherapist or counselor. Thanks for listening. To read the entire paper, kindly visit www.dersakoon.info.